All right, here's a short lecture on osteogenesis imperfecta. I have referred to it in other slides, and so here it is. It is also known as brittle bone disease because the bones often appear very brittle and they're very fragile. As you can see on the slide, osteogenesis imperfecta, or OI, is characterized by fragile bones that break very easily. Because of the brittle bones and fragile bones, I should say, they may also have muscle weakness, hearing loss, which I think is interesting, particularly because of the bones on the inner ear, fatigue, joint laxity or being hypermobile, curved bones, scoliosis, which is curvature of the spine, brittle teeth, as well as respiratory problems. So there's different types or different types of not types, but different levels of osteogenesis imperfecta. And so the more milder cases, or the more mild the cases, the fewer the fractures. The more severe the cases are, you'll have multiple fractures. And so the incidence of osteogenesis imperfecta is about 1 in 20,000 births, so not too common. I have worked with a little boy, who has a milder form of osteogenesis imperfecta, and we actually got funding for him to get a motorized wheelchair. He lived in a farm, and they had like scoria and gravel roads outside their farmhouse, and they had a ramp for him to get into, and he was ambulatory with a walker, but if he were to trip and fall on something on an uneven surface like scoria rock, it would put him. I mean, he could get he could easily get multiple fractures from falling. So we were able to get him a motorized chair for that. The etiology is caused by a mutation on a gene, causing problems with the type 1 collagen formation. So type 1 collagen is found in the skin, ligaments, tendons, demineralized bone, and dentin as far as our teeth goes. It is not caused, osteogenesis imperfecta is not caused by poor nutrition or too little calcium. So it's not like you can just tell these people to take calcium supplements. Not that we would do that as OTs anyway, but it's not because of that. There's equal frequency among males and females and among all racial and ethnic groups. Approximately 25% of children born into a family have absolutely no history with osteogenesis imperfecta. So that's pretty big chunk that have no genetic basis behind it. However, most cases are inherited from the parent, and a person with OI has a 50% chance of passing down OI to their children. And so, again, somebody with OI and having becoming pregnant, and just thinking how easy it is for them to fracture bones. I just think of the baby or the fetus kicking the mother in the ribs, and then the mom could have some serious complications with pregnancy as well. The diagnosis usually can be determined with an ultrasound while the baby's in utero. Between 16 and 24 weeks, so they can usually tell how the baby's bones are. Type 2 osteogenesis imperfecta is usually apparent at less than 20 weeks gestation. And so we'll talk about the different types here. Osteogenesis imperfecta will have to have some sort of doctor's examination as well, and genetic counseling can be recommended for those who have OI and who want more children, or for those who have the disease, or who had a child with the disease, and what their likelihood is of having another child with it. Sometimes skin or blood samples are used to study the type or the amount of type 1 collagen, or sometimes they actually do a DNA analysis as well. How doctors do their exam also has to do with looking at the type of fracture that's involved. And so we've talked before about how the green stick fractures occur, where only one side of the bone is broken and the other side is bowed. This is something that's very, very common with osteogenesis imperfecta. However, if you're constantly bringing a child into the emergency room and saying, oh, they have fractures, there's going to be some red flags to abuse that's going on. But a doctor could maybe not eliminate abuse, but come to the conclusion that this individual has osteogenesis imperfecta, and the fractures are not caused by blunt forces like being hit or physically abused in that way. And just another tidbit of information that's really important. Usually individuals with osteogenesis imperfecta or their parents, once they get the diagnosis, usually have a card that they carry with them in all places. So if they ever are going somewhere and they're going in for multiple fractures, they have this proof of this diagnosis. Otherwise, Child Protective Services and social services would probably be called in to look at if this is possible abuse. When diagnosed in utero, it usually means that it's a more severe type. The majority of these pregnancies do end in some sort of whether miscarriage or however you want to call it, but usually the pregnancy terminates on its own because of the complications. Multiple flat fractures and possible intracranial bleeding can cause death in utero or shortly after birth. I mean, you think of how traumatic and what a tight space going through the birth canal is, and how fragile these bones are. By doing a traditional vaginal delivery, you could have multiple fractures, and even fractures that lead to death around that time. Quality of life is very difficult to predict. Some people really have a difficult time. Simply weight bearing and walking can cause fractures. Where the little guy I worked with, he was ambulatory with a front-wheeled walker. He was very, very smart, very intelligent, and he had a very good quality of life. So it just sort of depends. Osteogenesis imperfecta a lot of times requires multiple surgeries, mostly to fix the fractures. And you saw the pictures of the external fixator and internal fixator for fractures, and this can be really difficult because it's not like you can put an internal fixation device because that has to be fastened to the bone itself. And so if the bone is brittle, by drilling or screwing a screw or a bolt into the bone to hold that fixation place, or to hold that fixator in place, could cause serious injury and further damage. But they do look at doing some sort of fixation devices and that sort of thing. So again, it just depends on the severity of the osteogenesis imperfecta, what kind of fracture it is, and how they're going to treat that. Respiratory failure is the most frequent cause of death for somebody with OI, and unfortunately, like many genetic conditions, there is no cure. So looking at the different types, type 1 of osteogenesis imperfecta is the mildest type. They have some mild bone fragility. There's relatively few fractures and minimal limb deformity. This is the kind of osteogenesis imperfecta I believe the child had that I worked with. There's lower than normal amount of type 1 collagen, but the collagen structure itself is normal. Infants lack fractures at birth and are of normal height. Something that's interesting, they might have bluish discoloration of the sclera in the eye. They have a high incidence of hearing loss, particularly in young adulthood, also because the bones in the inner ear are affected. Care issues that we may address, there may be developmental delay. If they are have fractures or they're in casts or under multiple surgeries, they're not able to develop their gross motor skills. If they have bowing of their bones, it would be rather challenging for them to have fine motor skills as well. They also may have joint muscle weakness, ligament weakness, and so for type 1, they say high levels of exercise and physical activity are good. As long as, they're being safe. Certainly somebody with OI probably would not be doing full contact sports, but doing some of that weight-bearing activities, like stair stepping and weightlifting and some of those kinds of things, and staying physically active is important. Type 2, on the other hand, is the most severe form. So in type 2, there's improperly formed collagen. In uterine fractures are very common, particularly in the skull, the long bones, or the vertebrae. Many babies are stillborn or die soon after delivery due to respiratory and cardiac complications. The sclera in the eye are very dark blue or even a bluish gray color. There's usually respiratory and swallowing problems. They are characterized with short limbs, small chests, very soft skulls, and their legs are usually in that frog-like position, like you would see a low-tone newborn baby or a premature baby. Genetic counseling is recommended for type 2 OI just because of the severity of it. And so, like I said, type 2 is the most severe type of osteogenesis imperfecta, and most of these children die before they're even born or shortly right after they're born. Type 3 is the most severe type of children who survive the neonatal period. They're going to have severe bone deformities. Respiratory and swallowing problems are common. They're going to be really, really short. And their head size is not going to be relative to their body size. The sclera in their eye are going to be white with a tint of blue, purple, or gray. And for care issues, obviously, we're going to want to prevent fractures as much as possible. We're going to want to help them with their respiratory function, or monitor that as well. Or get a professional in, like a respiratory therapist who could monitor it. Provide a lot of emotional support. Because they are such short stature, and because they can't, or they have to prevent some of the fractures from occurring, it's going to limit what occupations they engage in. And so you may want strategies to help cope with that short stature and to help cope with them being so fatigued. Our treatment plan may consist of maximizing mobility and helping them be as independent as possible. Again, making sure they're safe and to prevent any fractures from happening if possible. Type 4 is moderately severe. The fractures certainly range in severity. The diagnosis can be made at birth, but usually with type 4 it occurs later. There is moderate to severe growth issues, so they're going to be really short in stature also. The sclera are often light blue in infancy, but it usually fades to white over time. Adults also may have brittle teeth. Again, they're going to be shorter in height or height. Care issues, again, we're going to prevent fractures. It's not uncommon since their green stick fractures are common with OI. And so you may see some scoliosis. Again, coping, helping the family and provide emotional support as well. And much like the other types of OI, we're going to want to maximize their mobility and function and monitor their safety. So it would be important for us to teach parents safe handling techniques and protective positioning and safe movements. Avoid certain activities such as contact sports. Swimming has been a popular activity because of the buoyancy of the water, and it's kind of takes some of the weight and distributes that evenly. Since they fatigue easily, you may do energy conservation as well. And then, of course, we want to promote that healthy lifestyle with no smoking, um, no caffeine use, avoid steroid medications, because all of those things deplete calcium. And even though OI is not a calcium deficient diagnosis, we don't want them to be taking calcium away from their bones either. So we just want to promote that healthy lifestyle. When I talk about techniques for safe handling, um, parents sometimes hear and read about this diagnosis, and of course they freak out because they don't want to hurt their baby. They don't want to hurt and give them additional fractures. And so a real easy technique that I've taught parents has been just with diaper changing, and having to lay the child on the floor or on a mat and rolling them from side to side, because most people, when they change a baby's diaper, they grab them by the ankles and they lift them up, and then they use their wipes and stuff like that. And by grabbing and pulling on a child's legs with this diagnosis, it could break those. And so by gently rolling from the infant from side to side, you can avoid pulling and really straining on their legs. Treatment, your focus is going to do anything to minimize fractures and maximize mobility. Again, are you going to use a front-wheeled walker? Are you going to recommend a motorized wheelchair? Are you going to recommend a manual wheelchair? We want them to be as independent and safe as possible and to minimize their fractures. Treatment may also consist of OT and PT. We could look at casts, splinting, wraps for broken bones, maybe braces to support legs, ankles, knees, and wrists. Orthopedic surgical rods are sometimes implanted to support the long bones in the arms or the legs, sometimes along the spine. There are medications that they can give them to strengthen bones, and they also will need some mobility aids, whether, again, they be front-wheeled walkers or other kinds of walkers, canes, wheelchairs, all sorts of things. So here you can see the humerus on the left-hand picture here. You can see that green stick fracture. It's full on, or it's solid on this side. There's a hairline crack on this side, and you see that bowing here. You can also see, it looks like the ulna. You can see a little bit of bowing right there as well. I believe on the left-hand side, or on the left-hand x-ray, you see that excessive bowing here. It looks like this might be a full fracture or closed fracture, but you still see that bowing. Some significant bowing here also. I'm thinking that's the radius and the ulna, and so you can see what those bones look like under x-ray. Here is the femur, as well as the tibia and fibula, and so you can see the deformity here, and you can really see the deformity and the curving here. And here it even looks like it might be a green stick fracture as well. So myths about OI. Way back when, with this diagnosis, people were told that they should only carry their children on a pillow and discourage them from moving at all. And the fact is that the child's best interest is to be held and touched and to be able to explore their environment still, and give them that independent movement, because immobility increases bone loss and decreases muscle mass, which is going to contribute to their weakness and contribute to their bone fragility. And so we do want them to get as much activity as possible, but we just have to be careful with the fractures. People who have OI cannot have children. That's false. OI does not affect fertility. But again, some women may experience some severe pregnancy complications due to skeletal issues, meaning if the baby kicks them in the spine or the ribs or their hip, something like that. They could have multiple fractures. Those fractures could rupture the membrane. It could protrude into a lung. I mean, there could be some serious complications. Here's some videos of osteogenesis imperfecta. Living with osteogenesis imperfecta. It's just 3 minutes, 3-minute clip. Here's a newscast. Also, this one is my favorite. It's really, really short. It's about a cheerleader who has osteogenesis imperfecta. Plus, it's a really good visual of the short stature, and you see some deformity in her arms. And then there's a mom's perspective too on osteogenesis imperfecta. So be sure to watch these videos.